Here, the coronavirus pandemic has shined a light on the crucial role nurses play in our healthcare system. As we recognize National Nurses Week as well as National Hospitals Week, we pay tribute to hospitals and the people who put patients at the center of everything that they do. This week, healthcare workers have an opportunity to call attention to the innovative ways they are supporting the needs of their communities while taking the lead in the fight against the pandemic. Joining us this morning via Skype is Arnold Ubalde. Good morning to you. He is an ICU nurse for Dignity Healthcare at Glendale Memorial Hospital. Great to have you with us, and thank you for taking the time to speak with us.
Good morning.
So right off the top here, we have seen nurses truly take the lead in the fight against COVID-19, even at a personal cost to themselves and their families at home. So tell us what it's like, I mean, from your perspective, from your mouth, on the front lines of this pandemic in your hospital.
Yeah, so I work in the ICU COVID unit of the hospital. So I really have firsthand experience as to how, we deal with this crisis. So it's like being in a war zone, but you don't know where your enemy is because, the virus, you can't see it. So it's very scary because when you get into the, the patient's room, the chances of you getting infected is really very high. It increases many folds. But, we are trained. We have the education to fight the, how to deal with this crisis, how to deal with the virus. But one of our concerns is really making sure that we have enough personal protective equipment, or the PPEs, in order to protect ourselves and in making sure that we do our jobs safely and efficiently. Fortunately for us at the facility where I work, we have enough PPEs, and our management actually did a very good job in making sure that all the frontline workers would have enough PPEs to use while working in the hospital. So yes, it's scary, because we don't know much about this virus in the beginning. But as we move on and learn about the disease process and the virus, our education, our training, and the use of PPEs, we found out that we really can work and deal with this crisis effectively without actually compromising our safety.
Well, Dr. Ubalde, let me cut in here for a moment, because we've done so much to shine a light on the heroic work that you're all doing, but it's such uncharted territory for you as well. How are you coping emotionally, knowing that you're at risk, that this is a pandemic and a disease we know very little about? How are you personally coping with this threat?
Personally, it's scary because I know that I'm exposed every time I go into the unit, and I have a family of my own, my wife, and I have a 17-year-old child. So, and my son is actually, is immunocompromised. He has a disease also. So the impact is great because even at home, I have to maintain the presence of mind. I have to make sure that we practice social distancing appropriately. As much as we can, so, and I don't want my family members to be infected as well, and it would be very difficult for me to accept that, because that means I didn't do my job well, and in doing so, affected my family.
Yeah, it's a lot of pressure on you, not just to what you're doing in the ICU, but also with your family.
Yeah, so what would you say this has taught you about nursing and about this profession and the path forward? Things are probably going to look very different.
It will be, what I realized is that really the importance of the nursing profession, especially in this time and also
Dr. Ubalde,
in the future.
I'm so sorry. We warned you of this when we took our interview. Dr. Fauci is appearing at a hearing this morning in the Senate. We're going to take him live. Thank you so much, and we wish you the very best of luck.